basophils and eosinophils to the affected area. Macrophage migration inhibiting factor, which is MIF, keeps macrophages in the local area of infection.
Back here live on Monday Night Raw from the University of Tennessee, Knoxville, Tennessee, six-man tag team matchup. Division taking on the Street Profits and Joe Hendry. And here is Angelo Dawkins taking a fight to Austin Theory. The Profits want to earn a future tag team championship opportunity. They step up Enziguri, covered out by Dawkins, hooks the leg, and Theory kicks out.
Yeah, knocking off the reigning tag team champions in six-man competition could certainly do a lot for the Street Profits' case of deserving.
You mentioned before the return of the Street Profits a few weeks back for a tremendous shape for both Dawkins and Tez.
No doubt about it. Some would say Angelo Dawkins in the best physical condition of his career, but Logan Paul right now just teeing off.
Logan Paul, a former United States champion and tag team champion as well. And Paul in the corner, nobody.
Helper factors stimulate plasma cells to produce antibodies. Interleukin-2 stimulates proliferation of T and B cells. Gamma interferon helps make tissue cells resistant to viruses, activates macrophages, and causes killer T cells to mature. Perforin causes cells to break down. Suppressor factors suppress antibody formation by T cells.
Of a WWE superstar before our very
Activated macrophages also release chemicals called monokines. One is interleukin-1, which stimulates T cell proliferation and causes fever. The body produces fever or elevated temperature as a response to attempt to kill the invading pathogens by changing its environment. The other is tumor necrosis factor, which kills tumor cells and attracts the granulocytes to the area. Blood proteins complement cause the breakdown or lysis of microorganisms and enhance the inflammatory response.
Several months ago.
Tag made.
I'm back at it like a crack addict. I'm back with another left.
Division, which has been sculpted recently. Division of New York. Paul Heyman. And now a military press by Breaker into an uppercut by Paul. Great double team. Cover now on Montez Ford and a kick out at two. The lackadaisical cover from Logan Paul. You're not going to keep someone the caliber of Montez Ford down like that. Heyman has been all smiles the last 48 hours.
Monarchines. Monarchines.
As you take another look at the impact of the uppercut.
You can't overstate the importance of chemistry in a six-man tag team environment. Obviously, the tag team champions used to teaming with one another, but you add Braun Breaker into the mix and it's seamless. Covered by Paul.
Both legs hooked and forcing Montez Ford to kick out again.
Whereas the only thing bonding the Street Profits and Joe Hendry is their mutual dislike of Division.
The Street Profits involved in their first matchup in 3 years on Monday Night Raw. Now part of the Monday Night Raw rosters, Logan Paul with a cheap shot to Angelo Dawkins.
Ford and Dawkins both understanding, finding out firsthand how much the landscape has changed, how tough the Raw.
Okay, how often have you heard that laughter is the best medicine? This really does have some truth. Scientific research has shown that stress debilitates the immune system. People under long-term stress frequently get minor illnesses like colds more often than individuals who are leading stress-free lifestyles. Our moods, beliefs, and feelings can affect our level of health. For example, people with strong positive attitudes about life are often able to overcome illness much quicker than individuals who constantly harbor negative feelings. Stress is the great open door for the development of disease. During stressful situations, the adrenal cortex secretes cortisol. One of this hormone's effects is to suppress immune system activities. Feelings of despair, chronic melancholy, hopelessness, and inadequate ability for self-help can all contribute to increased susceptibility to disease. A smile a day can keep the doctor away. Individuals with feelings of strong social acceptance, who enjoy their work and have a strong commitment to achievement, and who believe they control their own destiny, are much more likely to be happy. These individuals are resistant to any negative effects that stress may exert over their lives. In addition, scientists recommend that we eat balanced meals, get adequate sleep, and relax periodically. Why not take a real vacation to maintain a healthy immune system? The amount of sleep needed to relieve or control stress varies, with individuals averaging between 6 and 8 hours nightly, but everyone can smile and laugh on a daily basis. In addition to these cellular and chemical barriers inside the body has an external covering and other protective mechanisms. The skin's epidermis is a mechanical barrier to pathogens and toxins. It also has a so-called acid mantle with an acidic pH that inhibits bacterial growth. Sebum from the sebaceous glands has antifungal and antibacterial qualities. Tears from the lacrimal gland and saliva contain liposome, which destroy bacteria. Mucous membranes lining the digestive, respiratory, urinary, and reproductive tracts trap microorganisms and dust and prevent them from entering the circulatory system. In the nose and throat, the mucus dust package is brought up to the throat to be swallowed by the action of cilia on the free edge of the epithelial tissue. The hydrochloric acid in the stomach then destroys most pathogens. Even the hair on our nose have a role to trap large particles and filter them out before they enter the respiratory system. So here is an overview of the body's defense mechanisms. So we have antigens. They can either go to specific defense systems or non-specific defense systems. Then once they're in the specific, they can phagocytize, or the phagocytes engulf the antigens. The helper T cells, they secrete lymphokinase, and then they can activate the division of T lymphocytes or B lymphocytes. And then from there, if it's T lymphocytes produced, then we get killer T cells and memory T cells. And then if it's B lymphocytes, we produce plasma cells, memory B cells, and then plasma cells produce antibodies, which aid in destruction of bacteria. And then the killer T lymphocytes destroys infected cells by disturbing the cell's plasma membrane.
Tag team matchup, six-man tag, visually gets victory in the Street Profits, but it's been all division for the most part of this matchup. Division has been able to isolate Joe Hendry.
Okay, as the body ages, at birth the thymus gland is fairly large but decreases in size as we age. It eventually is replaced with adipose tissue, thus losing its ability to produce new mature T cells. The number of T cells in the body remains fairly stable, however, due to their constant replication in secondary lymphatic tissue. With advancing age, we become more susceptible to infections because our immune response decreases. Older adults also tend to produce more antibodies against their own body cells, resulting in autoimmune deficiencies. As the aging process progresses, T cells become less responsive to antigens and fewer of them respond to infections. Since the T cell population decreases as we age, B cells also become less responsive so antibody levels do not increase as rapidly in response to antigens. It is therefore recommended that vaccinations be administered to older adults before the age of 60. Older adults also should be encouraged to receive yearly influenza shots because they are more susceptible to the flu. With decreased immunity as we age, latent pathogens can be reactivated. For example, the chickenpox virus that erupts in children can remain in the body in the latent state within nerve cells. As we age, the virus can leave the nerve cell and enter the skin cells, resulting in painful lesions known as shingles. The increased susceptibility of older adults to various types of cancers is also assumed to be related to the immune system's decreased response to cancer cells. Individuals with an interest in lymphatic system can pursue careers related to the study of immune response. So you can be an immunologist, an oncologist, a cytotechnologist, or a lymphedema therapist.
Sending Dawkins over the top rope.
Okay, common disease, disorder, condition, disorders of lymphatic system. So, allergies. Allergies are hypersensitive reactions to common, normal, and usually harmless environmental substances referred to as allergens.
Made it abundantly clear to Rollins, stay out of our way.
I don't think Montez realized what happened there, though.
I don't think he did either.
Because this is going to be an HR nightmare. I want to make sure the paperwork is correct. You're telling me we have Bruto y Julio. Sí. ¿Hablas inglés? Un poquito. ¿Español? Un poquito.
Okay, some examples of are house dust, pollen, and cigarette smoke. The reactions to the allergens can damage body tissues. Over 20 million Americans have allergic reactions to inhaled allergens. When the nose is affected, we refer to it as hay fever. In the lungs, it is referred to as asthma. If the eyes are affected, it is called allergic conjunctivitis. If the material is swallowed and affects the digestive tract, it can result in diarrhea, vomiting, or cramps. Contact to the skin can result in contact dermatitis. Hives can develop when certain foods cause allergic reactions, or when drugs, animal hairs, or insect stings are encountered. When exposed to a certain allergen, antibody IgE is produced and attaches to basophils and mast cells. These cells release histamine and prostaglandins. Histamine causes the secretion of mucus from mucous membranes and causes capillaries to become more permeable. Prostaglandins cause smooth muscles to constrict, as in the bronchioles of the lungs. Such an inflammatory response produces a runny nose, sneezing, difficulty breathing, and congestion, as with asthma and hay fever. Severe allergic reactions can result in anaphylactic shock, accumulating in death. Some individuals are overly sensitive to bee stings and certain drugs, resulting in severe bronchial constriction, mucus production, and breathing difficulties. This lowers blood pressure and can lead to death. The severe allergic reaction is called anaphylaxis. Treatment can use desensitization, which is exposure to minute minute amounts of allergens over time, or the use of bronchodilator,
and I can answer everybody at the same time, bro.
On this screen,
It's just lit, dog.
everybody at the same time, bro.
That shit's lit.
Lymphoma is a tumor
of the room.
It usually is malignant. It begins as the enlarged mass of lymph nodes, usually with no accompanying pain.
Disappointing.
You guys can write this down.
Can you see that? I can respond from one screen, bro. This is lit.
See that?
Oh my god, this shit is so lit right now, y'all. You don't even know, bro.
Oh my god, this shit.
Oh, we killing it right now.
You don't even know, bro.
Going on a bender.
Gives you more because more is
Going on.
You about to watch, we're about to watch, Psycho Clown versus Cody Rhodes, y'all.
We're about to watch
Psycho Clown versus Cody Rhodes.
Psycho Clown versus Cody Rhodes, y'all.
Hey, there's a little sign issue. I got this prison. There's no. I don't know if there's a sign issue. Can you hear me?
I got this.
I'm doing go to my kick, bro. Go to my kick and my YouTube. Go look at the camera, dog. Look at the camera, dog. I'm kicking YouTube right now. Go to my kick real quick.
Look at the camera, dog.
You need to go to YouTube, dog. Oh, hit my YouTube.
Hodgkin's disease and
Look how this shit looks on YouTube.
the name Hodgkin's disease was named after an English physician in 1832 who first described a group of patients with lymph node swelling in the neck.
Yeah, go check the YouTube channel out.
The disease usually manifests itself in the 20s or 30s.
Yeah, go check the YouTube channel out.
Go check the YouTube.
The disease tends to involve the reticular cells of the lymph node rather than the lymphocytes. Treatment with drug and radiation is effective for most people with lymphomas. Lymphadenitis is inflammation of lymph nodes or glands. They become enlarged and tender. When microorganisms are being trapped and attacked in the lymph nodes, they enlarge.
I'm gonna put it in the mob chat so you can see it.
Is indicative of an infection. Very
I'm
often when you visit a physician when you're ill, the doctor will feel for swollen lymph nodes in the neck region.
Look at the YouTube though.
Look at the YouTube though.
Hey, why is YouTube stuck?
Wait, why is YouTube stuck?
YouTube stuck, y'all.
My YouTube stuck, y'all.
Oh no, it's alright, it's working, it's working. Yo, you see it? Let's go!
Yo, you see it? Let's go!
Yeah, look at that! Way better off! Way better! I'm the macho man! Yeah, you see it? It's way better on YouTube. I want to hook up my YouTube like this, yo.
It's way better on YouTube.
Yeah?
My YouTube like this, yo.
Yo, what it do? Thank you for joining, dog. Yeah, see, this is how I want it.
Yo, what it do? Thank you.
This is how I like my setup, you know what I mean? See how it looks all cool, like...
This how I like my
yeah, it's dope, exactly. If I can't get in my Twitch like that, because I need a PC. I need the PC so I can play the Twitch with the PC. It's a whole different thing. That's why you need a PC to do it.
Twitch with the PC, it's a whole different thing.
Yeah, no, this is dope. Yeah, I like it too, dog. It's like, it brings out everything, dog. Oh, you're out. We're smoking. Sit your ass down. Fuck out of here. No, fuck out of here. Sit down.
It is caused by bacterium
Fuck out of here.
transmitted to humans by the
Sit down. Sit down, you're not smoking.
xenofly.
Yeah, you see this shit? Hey, oh, and look, bro, look. I can answer, bro, all thoughts, bro, through one thing right here. Right here, it's like, bro, look. I can know, bro, on my chat, on the platform, and then it answers you guys, dog. It's so cool.
On the platform, and then it answers you.
Without treatment, death follows quickly in about 80% of cases.
Audio is a little loud? Oh, audio is a little loud, okay, good.
The population of Europe. Before effective treatment with antibiotics, like penicillin, chronic plague outbreaks occurred throughout the world. Fortunately, few cases ever occur today.
Audio input.
Maybe that's a little better.
There you go. Maybe that's a little better.
But yeah, I can answer the chat, everybody's chat through here.
But yeah, I can answer the chat, everybody's chat through here.
Oh, this bitch is talking too loud.
Oh, this bitch is talking too loud.
Oh, they're picking up everything, nigga.
Oh, they're picking up everything, nigga.
Hold on. It's picking up.
Hold on.
Background sounds, it's picking up everything.
It's picking up. Background sounds, it's picking up everything.
Yeah, the audio is hella loud.
Yeah, the audio is hella loud.
Hold on.
Hold on.
Hold on.
Hold on.
That shit was picking up all of everything, bro.
That shit was picking up all of everything, bro.
Yeah, I'm having audio troubles, I guess, too.
Yeah, I'm having audio troubles, I guess, too.
Yeah, no, the background sound is crazy. This is the first time I've used this.
Yeah, no, the background sound is crazy.
This new.
This is the first time I've used this. This new.
Alright. I'm taking the desktop audio down.
Alright.
Maybe that's
I'm
it.
taking the desktop audio down.
I put the mic down.
Maybe that's
Put the audio capture down.
I put the
See
mic
if
down.
that worked.
I put the audio capture down. Let's see if that worked.
I think I worked it. I think I fixed it.
I think I worked it.
Yeah,
I
you can
fixed
hear
it.
the PS5 humming.
Yeah, you can hear the PS5 humming. No.
Yeah, no, I don't know. This is crazy. That's the first time I'm using this
This is
app.
crazy. That's the first time I'm using this app, too.
Research is constantly going on to try to understand and combat this dreaded disease. Some individuals have the virus, but never develop any symptoms. Others
I hear it like 3 times. Hey,
like
this
3
shit
times.
crazy, but oh, bro. That shit was hilarious. Bro, I'll clean your PC. Bro, I'll clean your PS5, dog.
Bro, I'll clean your PC. Bro, I'll clean your PS5, dog.
I'm trying to just get a setup. Trying to get a different setup.
I'm trying to just.
I need good audio with this
Trying to
new
get
setup. I guess.
different setup.
I gotta
man.
figure it out.
I need good audio with this new setup. I guess. I gotta figure it out.
But I like the setup. The setup looks good, but the audio is.
But I like the
crazy,
setup. The
man.
setup looks good, but the
Hold
audio
on.
is crazy.
Oh, I know what it is.
Hold on. Oh, I know what it is.
I know what it is. System sounds. Prism Live Studio. Is that better? I'm changing all the system settings. Damn, echoes. Oh, I know what it is. I know what it is. I think it is the camera and me talking at the same time. Hold on, let's see if this works. Let's see if it worked. Did it work? Yes. It sounds way. I know exactly what it was. Because I'm on the camera. Because the camera is picking up the audio, and the audio mixer is on, trying to pick up audio as well. I fixed. Let's go. I fixed it. Let's go. Yay! All right. Let's go, y'all. Yo, we have 3 watching on YouTube and 3 watching on no, still a macro. No. I muted myself. Okay. Unmuted all. Okay. Did it mute? Can you hear me now?
One of the symptoms is a red butterfly-shaped rash over
Nope.
the nose.
Can't hear me now.
The exact cause of the disease is not known, but a viral infection may disrupt the normal functioning of the immune system.
The echo is probably because I have the thing in my ear right now. I think we're good. I think I'm good. And now to go. Yo, let's go. This chat's tight. Oh, this chat's tight. Alright. We got the problems, the technical difficulties out the way. Alright. I can answer from right here. I don't have to go to this, pull this up. I don't have to pull that up, pull this up, pull that up. I can literally answer from one spot, bro. It is so cool. It's the best feeling right now. I got, hey, Prism Live, dog. Prism Live. I told you, get Prism Live. Hey, Prism Live, dog. Prism Live. I told you, get Prism Live. Prism, y'all. I'm gonna chill. We're gonna watch this next one. I'm out, so. We're gonna watch this next one. So, oh no. Small echo, huh? Alright. Small echo, huh? I wonder if this. Alright. I wonder if that helped. Let's see. I wonder if this. Let's see if that helped. Let's see. Let's see if that helped. Echo. Echo. Let's see. No, it didn't work. I'm just repeating. I'm just repeating. don't know why it's playing back to back though. Yeah, it's repeating. What the fuck? Yo, yo, yo. Yeah, no, I fucked it all up. Now I can't hear shit. I fucked the whole sound up. Now I can't hear nothing. Whatever I did, I fucked it all up. Oh, I did something. Yeah, I don't know. I fucked it all up now. Yeah, I know. Oh no. sun, yeah. I don't know. Can't even hear the audio now. technically difficulties. Fuck is that? Monitor off.
But your growth originates in little pockets and then drains out. So these little where you're producing the fluid and then it's exiting out constantly and can't work that direction thanks to the valves. They typically do have larger diameters than the blood vessels, but thinner walls, and also the endothelial cells of these lymphatic vessels move around. So if you looked at the endothelial lining blood cells, those cells are flush neutral. They're directly adjacent. So you're going to see some endothelial cells if you zoom in really close on a micrograph or microscopic picture of the lymphatic vessels, the inner lining of the lymphatic vessels. All right, these little nodes, these are the small organs that vary in size depending on which one has some 1 millimeter in diameter, some 25 millimeters in diameter, which is quite large. Most are concentrated in the neck, armpits, and groin, and you generally don't think about that until you go to the doctor when you're sick. The reason why the doctor will feel this area of your neck where you have some kind of cough or sore throat is they're checking whether or not your lymph nodes are swollen. So if your lymph nodes are inflamed and puffy in this area, that tells you that your lymph nodes are kind of working overtime. That inflammation in those regions means you're probably combating fighting against some kind of infection.
I don't know, this is
And they're also
fucking
going to be
retarded.
located in the armpits and in the groin region, but they are scattered throughout. Just they tend to
This shit is retarded.
and the lymph nodes, they function like a kitchen water filter. First, you enabling your white blood cells to know what the bacteria has on it,
Fucking audio.
protein structure, and being able to identify it quickly and
Stupid.
get rid of it out of your body. This is a drawing of the pelvic region, your groin, The red areas, the reason behind the red is because red blood cells. If that makes sense. The white areas is where you have sort of that lymphoid section, the area that has a lot more lymphocytes, kind of screening the blood that's coming in and dealing with harmful things that don't belong there. So it's like a highly controlled security checkpoint. In general, those little lymph nodes, they're like little security checkpoints, but this is where a lot of security is going on in terms of locating the harmful stuff that doesn't belong in your body.
It's getting closer.
Alright, now in terms of the different kinds of defenses, we can talk first about non-specific defenses, and I mentioned these earlier that
It's getting
the
closer.
response in terms of the non-specific defenses is the same regardless of what's invading, and they also call it non-specific resistance. So one example is physical barriers. If you think about all the layers and parts of your body that, like let's say air has to go through to finally get to your bloodstream, you have a lot of physical barriers. Think about the air you think in terms of, dust getting caught in the hairs of your nostrils, in the mucous membranes of your nasal mucosa, then you swallow it sometimes. Blood vessels in the area, you get more blood flow in terms of volume, and that's going to get more white blood cells to the area. And the more white blood cells go to the area, the more likely it is you're going to get rid of that infection quickly. Fever, fevers happen, and they're very uncomfortable, but it serves a purpose. So here's the Celsius scale. Normal, it depends on the person, and we're talking about height, it's going to be a different number. Obviously, 37 degrees Celsius, that's high 90s. 98.6 is what a lot of people say as well. My normal's 98.2. Some people might be 98.3 as their own baseline, but regardless, where you are in that 98 degree range, your regular body temperature is going to be about 37 degrees Celsius. If it gets up into high 37s with 38 degrees, 39 degrees Celsius, we're talking a fever. And that usually means that you are sick, something substantial. So the fever, why does it happen? Why does my body heat go up? It makes it harder for the virus or bacteria to spread in that hotter environment. So it does serve a purpose, even though it causes some discomfort, and we have sweating a lot, and it's just not pleasant. It does serve a purpose. There are medications that will reduce your fever, but still enable white blood cells to get the job done. All right, specific defenses. So depending on the particular type of pathogen, you're going to have very specific kinds of reactions to that. So this is known as immunity. You become immune to something. So this is the coordinated activities of B cells and T cells, two major types of lymphocytes. So here's the two kinds of immunity. Innate immunity means you're born with it. You're born with the ability to react to different things that you're exposed to. You can't change that, so that's based on genetics. But a lot of immunity is acquired. It's picked up just by living, by you being exposed to different pathogens or foreign bodies. So when we talk about acquired immunity, what you gain as life goes on, you can talk about active acquired immunity versus passive acquired immunity. So active acquired immunity, how do you naturally acquire it? Well, a good example of that is think about a baby that's just been born, and they get exposed to something, some germ. That's an example of how a baby can naturally acquire active immunity. So the baby's sucking on something that had germs on it, well, introducing that bacteria from that toy, whatever they had in their mouth, that's going to allow their white blood cells to identify, be like, oh, okay, now we know what this is, we'll be able to prevent it spreading in the future. So that's just being exposed to stuff in your environment. Induced active immunity is vaccinations. So
you can hear the teacher talking. That's crazy, because that's the lowest thing in this room.
Are immunized against chickenpox. When I was a baby, they didn't have that.
That's crazy.
But do you know what happened to the Takis?
The chickenpox thing in the future.
Yeah, they're in my bag.
I got chickenpox when I was about 7 or 8.
In your bag?
Yeah.
Chances are I'm not going to get it again because I have cells that have retained a memory of what that chickenpox virus was like. So if
in my office bag.
In my environment, I'm not going to get sick. However, some people do get sick with chickenpox more than once because sometimes the second exposure.
What up?
Genetics of that particular chickenpox virus was slightly different.
I know. I'm in class. So I'm live on wrestling because I'm letting wrestling play.
If you've been vaccinated, you get exposed to.
No, I'm just letting the matches play
It's like exposing.
so I can get views. You know.
To the they look at the proteins like, oh, okay, that's what this thing made of, and they're able to kind of retain a memory of what that's like.
No, I just have it on. I'm in school, but I'm trying to stream and get some hours in the streaming still.
Here's an interesting example of vaccination. I found this.
No, I'm at home.
I wasn't sure the exact.
I got to be here till 11 on the screen.
Smallpox was still an epidemic that was a problem.
You gonna be on?
Be vaccinated to your
Yeah.
You actually gonna get on
Yeah, we were on last night. For like. Yeah, we were all on. I was on at 11. But I hit Scotty at 1. I thought Scotty was gonna be up still.
And then when you get to the point where enough people have been vaccinated, and the people who currently
We were on.
are spreading it to others, the people with smallpox, once they pass away, the smallpox has no humans to be inside of and pass it along to other individuals. So we now consider this to be there are smallpox samples
Alright, bet.
in labs around the globe.
Alright, let me too.
Hopefully they stay there and aren't exposed to anything. Because we don't
Yeah, I'm watching the school stream, but
It's a passive acquired
how?
immunity.
Do you hear the
For
lady?
example, passive acquired immunity in terms of
But you don't hear me.
acquired is when you're a baby, getting antibodies from your mom. So not the actual, surface of the virus or surface of the bacteria.
I'm
You're
picking
getting
up on next Wednesday, and then you're coming till before 2 days before Zariah goes back to school.
I was gonna ask you, tell Jeremiah to go on the basket page. They're hiring painters and finishers ASAP. Good money.
And then you could come help me pack. You're gonna help me pack this house. No, but you can help me put it in boxes, cold clothes.
Twitch sounds great. I know, my Twitch sounds good, but you can't see the camera. You can't see the camera on the thing. It's crazy. So everything sounds good, but you can't hear shit.
Look, wait, sit down. She's trying to talk to you.
What?
She's talking shit. She's trying to talk to you.
What?
She's talking shit, trying to talk to you.
So? What's new?
He says, so, what's new?
Yeah. I mean, I would have kept my job if that was the case. That's why I'm going to school.
He said we would have kept his job if that was the case.
I just seen it right now.
Oh, okay. Oh, look it. I got for Jmafiia at Dollar Tree. But he's not graduating high school. High school.
I know it's 8th grade, isn't it?
Yeah,
I don't understand.
14. Got him leave at Dollar Tree.
I do not understand.
Senior graduates from 8th grade at 14.
That's the age you graduate at 14, Mom.
And it will be a little bit next year, and then you'll be in 10th grade. 6, 8, 12, 7, yeah? We just had pizza night because Grandma, I'm gonna be 11.
Oh, I get it. I know exactly what it's playing off
I
of.
want to do a school year with me. Look at, I got him these at Dollar Tree.
That's cute.
And then I got this at Dollar Tree. But when you come,
That's cute.
it says happy.
Tonight, you should go to the Lowe's or Walmart and buy $99.
Graduation.
Did you hear me?
Yes. And then I got Mi Tengo Mesa. I don't know why I got it, but I got $10.
Here.
Okay, you might find her at a yard sale, local yard sale, and you will find the tip.
Yeah.
This is so stupid. I'm still trying to find out.
Yeah.
Yeah, but it looks good. I just can't get the audio, man. It shit looks so good.
Here.
Candy gets on, you can't smoke that around Canyon.
Here. What are you doing anyway? Lakers lost yesterday.
Don't talk about my Lakers.
They lost.
You want this or not?
You want this or not?
My Twitch sounds good.
My Twitch sounds good.
It's picking up a double audio.
It's picking up a double audio.
Just look at all the gold on the world heavyweight title. A glorious looking championship, the envy of all men who don't possess it. And here we go. The WWE World Heavyweight Championship is officially on the line here. And you can bet these superstars are going to fight with everything they've got.
Oh yeah, the title I want to become a 6-time world champion holds a special place in my heart, as I imagine it does for the current champ and everyone vying for that title these days. Hard not to look good draped in big gold like that. Kick to the gut. Oh, brutal form.
Looks like a play to go after the legs down. A focused attack on the champion's leg, and there are some lingering effects. Set flying. I honestly can't believe we just saw a human being tossed like that. Ooh, going after that leg, doing lots of damage with an isolated attack on the challenger's leg.
DDT drives that head into the ground.
The champ with a quick kick out.
Early enough in this match that there's no need to rush into kicking out.
He answers right back. Taken down by the neck.
You got a delay echo. Why is this delayed? Because I don't have
An example of the
You got a delay echo.
only Brock
Why is it delayed? Because I don't have
below square one. This is a smart strategy here. He's able to combat out of Brock's grip.
And
This is how it sounds right now.
and he slips away. Sets up in the corner now.
This is how it sounds right now.
Shoulder tackle to the body. Striking blow. Stiff shot to the abdomen. Okay, for the championship. Stays in the fight for the title. Couldn't quite slam the door. Consider your title dreams dashed after that. Here's the kick.
It's stupid.
These guys were awesome. Let's take another look.
Shit's stupid.
My body's initial response, primary response to that, is going to be a fairly decent response. But if you compare that to the time that I'm actually introduced to meningitis let's secrete millions and millions of these antibodies. And that's how it's thanks to that vaccination. body's looking for. These are proteins secreted by. And the reason why.
Under output. What is calling? And I was using the speaker. No, it's that one. So this communicator on, yeah, and I was using the speaker. No, it's that one. Okay, Mania. Audio. Okay. So this one. Okay. So this one. Okay. I can hear the audio. I can hear the audio.
transfusions where there was an accident where they didn't know that the donor had HIV, unfortunately. Accidental needle sticks, sharing needles with drugs or tattoos outside of a tattoo parlor. But HIV, this virus is really good at invading helper T cells. And over time, as the virus makes more viruses, invades more helper T cells, eventually your white blood cell count gets low enough to the point where that person gets AIDS. And that's where, ironically, you end up dying from something like the common cold or chickenpox or pneumonia, those illnesses that the average person, the average healthy person can beat. But if you have this virus in your white blood cells that are allowing you to beat it, it's not going to work out. HIV is an RNA virus, more specifically a retrovirus, which means it has RNA and then makes DNA within your cells, which is kind of like backwards transcription. If you took biology, you may want to know that. Eventually, I believe there will be a vaccine or a cure to AIDS. There are lots of issues in the way of that, but there's a lot of money being poured into it, and the time will tell. Cancer. I have it here in the immune conditions disorders because cancer is basically cell division out of control, abnormal cell division. So if you have healthy natural killer cells, you may not get cancer, well until your 90s or 100s even. And by then, it might be a heart attack that kills that person. But cancer can happen in virtually any tissue of the body. Usually it's exposure to carcinogens, which are cancer-causing chemicals, or radiation that causes damage to the DNA that's regulating the cell cycle. And if that cell cycle, the regular amount of cell division supposed to happen, is out of control, that tissue can become a malignant tumor that's going to spread potentially through your lymphatic tissues to other organs, and that's how cancer ends up killing a person. The Western medicine approach typically is radiation projected on the cancer's tissue, chemotherapy, but there are other methods that people try to get rid of cancer. Lymphomas. Lymphomas is a disease, has to do with abnormalities in terms of your lymphocytes being able to deal with infections. One example is Hodgkin lymphoma, but there are many different classes of lymphomas, a disease that impacts the lymphocytes. Lymphedema is edema of the lymph. So I mentioned edema before with blood circulation, but this has to do with the lymphatic vessels. So let's say those valves, I mentioned the valves that keep lymph going in one direction and from pooling. If those valves start being dysfunctional, the pooling of lymph, the backup of lymph, can cause severe swelling in lymph tissue, and that's known as a lymphedema. Graft rejection, if you get an organ donation, maybe it's a kidney, maybe it's a new liver, they will give you immune suppressing drugs to keep your immune system from freaking out, because remember that MHC thing, if those proteins are not exactly as they should be from your normal DNA, you're going to get what's called graft rejection, where your immune system is going to attack that newly introduced tissue. And it could be something as simple as a skin graft. Maybe the person was a burn victim and needed skin grafts from a cadaver. Tonsillitis, that's an infection of the tonsils, and they also call them adenoids. They're collections of, they're like miniature lymphoid organs in the throat region. If you get a lot of throat infections, especially as a child, you get a lot of swelling of the tonsils, because the swelling is your body's response to that pathogen in your throat. It can be very uncomfortable and really irritating. So they'll go in and sometimes take out your tonsils, a tonsillectomy. So it depends on the person. I did not get a tonsillectomy when I was a kid. I guess I didn't get enough tonsillitis to qualify. But taking out the tonsils, it's not a vital tissue. It's just something to get rid of that annoying swelling and pain. You'll still be able to combat that particular pathogen without the tonsils. Thank you for watching Educator.com. You'll still be able to combat that particular pathogen without the tonsils. Thank you for watching.
Okay, you guys can go on break. I will see you back at 9:31.
This is your brain when you're struggling to focus.
Because we went on break a little late. So come back at 9:31, okay?
Hey Siri, set my timer for 9:29.
Because we went on break a little late. So come back at 9:31, okay?
Hey Siri, set my timer for 9:29. got to give y'all a match. Y'all just watching.
Ladies and gentlemen, the Beast Incarnate has arrived.
The following contest is a triple threat ladder match. Making his way to the ring from Minneapolis, Minnesota, weighing in at 286 pounds, the World Heavyweight Champion, Brock.